Hey everybody, I'm Kara from the Bridging Institute, and today we have Steve. And today's going to be a little bit of a different episode. We're going to be super focused on a very specific thing for him, and it's really nice that he's able to be here to share this with you. So Steve, you want to fill us in on what happened and why we've got some work to do with your arm?
Oh, sure. So May of 22, May 11th to be exact, I put my hand through a window at my house, and it was very old glass, and I did a very good job on it. I cut all the tendons, the ulnar nerve, and the artery.
It's kind of amazing that your hand is still there.
I was shocked myself when we cleaned it up at the emergency room. I was looking at everything.
Wow. And so what have they done since then? Because that's almost a year ago, or over a year ago.
So after they repaired the artery, my hand surgeon reattached all the tendons, and he had done put the nerve back together, like a wire. But then in February, he went in and cleaned out the scar tissue, and he saw that the ulnar nerve was not responding, so he did a nerve graft in February. And I did get more motion in my thumb, and the wasting started coming, started coming back. My muscles started coming back, and I got more movement.
Oh,
but
good.
I've sort of plateaued right now.
Okay, and you're right-handed, I'm guessing.
Of course.
So what? Steve actually has another procedure coming up, so that's going to guide a little bit of our focus today. They're going to be doing some work around the knuckles in his hand because, as you can see, it's still flexed, stuck in this claw position. Still, it's pretty amazing what the surgeon was able to put back together and how well he's recovered. What we found with another one of our videos, you can look up in the episode, how the hand and the fingers work together. They also need help from what's going on in the wrist, the forearm, the shoulder. Shoulder, I checked the movement there. It actually is doing okay. So we're going to focus on the wrist and the forearm so that as the procedure with the fingers starts doing its thing, that he's got some better support back here to connect into it. A lot of what we work with from a movement perspective is from the outer in, so that when you grab something, when your foot hits the ground, whatever, that Rube Goldberg of one thing connecting to the next flows from the hand in, from the foot in. This one, what he's dealing with is actually from the brain out, the signaling that comes that way. And really, we have to get both of those, but let's get the pipes put back together in the section that we can. And I think we've got a bit of work to do at the wrist, because if he just lets us go, I think you can see from the side, he collapses at the wrist. And before we get started in that, let me just explain a little bit more of why we're here. We help people stay active, and part of that is being able to use hands and arms to the best that you can. And sometimes medical procedures and injuries and accidents are what get us off track with that. You've got all of those. So a lot going on. But what we do is we're doing some problem solving to figure out what's he got here, what's working, what isn't. And that's an engineering based problem solving process of really looking at step by step, transition by transition. And then we're using a really gentle reset process, which is little movements that are little stretches and guiding movements to just connect the muscles back together. The tension shift repairs how the muscles are interacting together. And a lot of what we do is getting pairs and groups of muscles to work. So with the collapse through the wrist, what that tells me is that the muscles on the side and the top side, they're not working together. And so what we're going to want to do is wake them up. Usually what we find is that just going like this isn't going to do it. We have to add another dimension. So usually a sideways or a twist or both. And we have to figure out what does work already. And what's interesting, it's nothing that you'll be able to tell at home, but there's a temperature difference between the underside of his wrist is actually cooler than the outside. And so this speaks a little bit to the circulation things that got shut off. So they put the artery back together, but there's a lot of other little teeny tiny microvasculature that just doing a little bit of wiggling motions can actually get them close enough so that they're able to connect together again and help the circulation. We see that quite a bit when people have sprains and surgeries. And the other thing, like the palm side of his hand is quite warm, but the top side of the fingers is actually not as warm. So again, just speaks to the weird circulation patterns that are going on. Let's see. I am just going to support underneath the wrist and let's figure out what do we have here. So like what moves easily and has a little spring and bounce to it. So his hand turns one way and the other, but this feels like it has some control to it. This feels like it just sort of flops. So we go with control. I'm going to support down a little bit and just relax. There. And so when I have him relax, it changes. Okay, so it still turns this way. It actually doesn't turn the other way. Does that feel tight or does that? Yeah, so there's some balance between how all the different muscle strands through the forearm are able to interact with each other. Whether they work together before the injury is a whole nother question. Another part of Steve's background is, where were you for a little bit?
Oh, you name it. Iraq, Afghanistan.
So he's actually honored to have him here. He's a veteran and had some interesting experiences there. And he's had a lot of other injuries and surgeries from things that happened there. So how that involved your arm, anybody's guess. So we're just gonna, okay, if anything I do, if triggers some kind of pain, let me know, because we have to get a little creative on how we're finding pieces to match up. There we go. If I get to smaller chunks, I can find ones that know how to work together. And then your shoulder's gonna turn, there you go. And then we're gonna start adding bigger chunks. Same muscle, but just easier to fire when I'm giving it some support. I keep moving from where I feel some nice bouncy interconnectedness to where it starts getting tighter. And I go back. And there we go. Okay, so what we're going to find is at the wrist, it's going to start turning differently at the elbow and, oops, almost, not quite. Did they have pins in the wrist with the surgery?
No.
Wow, it's really good. Cast?
It wasn't a cast, it was that thermoplastic wrapped with those bandages that kind of get hard, but it's easy to take off.
Oh, yeah. The like splint, molded splint. Okay, so look what we can do now. So it does start to turn a little bit toward me. This is called supination coming up. It still kind of flops a little bit, so we have a little bit more to do with that. I'm going to change how I'm holding. Instead of at your elbow, I'm going to come up below your elbow. And still with this twisty motion, because that seems to be the motion that kind of works here. There. It's almost like it got screwed in too tight, and we have to, or like the child lock, you have to screw it and then it releases. So. Okay, this got stuck, but it feels like it's just log jammed and it's going to change. Whew. So what's cool is there's two bones in this forearm, the radius and the ulna. The ulna should be stabilizing and mostly staying put, and the radius moves. Your ulna moves a lot.
Yeah, my arm doesn't know what to do anymore. It's just like, it's, yeah.
So a little bit, we're reprogramming it. There. Oh, okay. So what just happened is this whole side, just like an accordion, like opened out. And oh, I didn't check this before, but I don't think you had this kind of motion.
It'll just go like that.
Yeah. Okay, so let's see about the rotating that we were trying to do before. So what's nice, do you feel the control?
Yeah. Compared to when you started?
Yeah.
Oh,
Yeah, it just flopped before. And actually, you're holding it and just let go. It doesn't collapse the same way. So we have more. So actually, this is kind of a key right now. This has to open up even more. So I'm not sure if from all the procedures it just sort of shrunk from atrophy of not being able to be used, or part of it got jammed. Who knows?
Probably a combination of both.
Yeah, probably. There. Oh, wow. Okay, that was interesting. So what I felt, instead of the accordion just right here, I actually felt it come all the way up your arm. There. So I have switched. I'm not doing a twisty motion so much anymore. It's a little bit more of a sideways. It's almost like we're trying to plug different parts together, and so there's a lot of reciprocal motion in the body. When one side stretches, the other side compresses, and then the opposite. So we're starting to get the side-to-side reciprocal movement happening, and the turning is actually going pretty well. So this, you know what, it's still stretching out like the accordion, but now it feels like instead of just on the side, that it's starting to stretch into the rest of the forearm. It's amazing what the surgeons and the medical folks can put together, but they don't know how to reprogram it.
They're there just to make sure everything's functioning again. You know, just, you can move your fingers again.
Right. And so have you worked with somebody for hand exercises also?
I've been doing hand therapy for a year now.
Yeah. So the thing that's different is if the nerves don't talk to each other, you can only get so much to work.
Okay.
So we're trying to line up the pieces so that the Legos are put together better. Okay, so now what's happening, I think you can feel this side is starting to stretch out. So before it was the outer side, now it's the inner side. Often referred to as lateral and medial.
And the thing too is, since you've been working, it's just the light movements. It feels like we've been stretching it like this because I've got that flow going through the fingers again.
Yeah. So actually, yeah, you should feel some different circulation. Because crunched up in there were all the little capillaries and.
Yeah, it was pretty traumatic injury. I mean, we were looking at everything when we cleaned it up. Yeah, there's pictures floating around somewhere with some of the nurses that got it. Oh yeah.
Not the celebrity you wanted to be.
No, I wasn't. But yeah.
Okay, yeah, it's still opening up on the radial side around the thumb. So I'm going to start giving leverage in a different spot. So that's some of the physics of what we're using is where the fulcrum is for the lever. So before I was at his wrist, which is where the joint bends, but then if I start coming further up his arm, it actually is how you're using more of the muscles all the way up to the elbow, and you're starting to figure that out. I can feel it like stretching out more and more all the way up, and then hopefully we're going to get your bicep to join the party, and that will give you some strength back. There you go. Oh, wow. Okay, so what happened was the index finger and the thumb, which structurally should muscle-wise connect to the radius, it's like the gears engaged and then they started to turn. So I'm holding so his ulna really can't turn, and the radius turned just the way it's supposed to. It's been a long time.
Been a very long time since it's done that.
Wow. Okay, so I think we're accomplishing part of what we wanted to, was to get you ready for the next, oh, boy, your fingers don't look as stiff either. Okay, I'd love to get some extension of the wrist, but yeah, let's see, what else do we have here? Oh, all right, so we've been matching up which sides have been tight and which sides have been loose. So the bottom of his wrist has been really tight, and the top has been kind of a little loose because it's just been hanging. I think we're ready that this is going to start stretching out. So you're going to start feeling here, and then, so there's a nice little scar here. Not so little. I'm going to support just the way that's, boy, it's actually cool to the touch. Okay, I'm going to put a support there, and not a light support either. It's kind of, you can't probably feel how firm I'm on there. And I'm actually matching using my forearm to his whole forearm and trying to match up what's going on through this whole area. And it's starting to stretch out.
And I can feel you touching, but I don't know how much pressure you're putting. It's very dull.
There. Okay, so yeah, like all the scar tissue here, and they already cleaned some of it out because it's still actually a little bunched up there. But some of that is limiting your motion. And let's do a little bit more. I'm going to go to a smaller area that's just right here, and we're just going to wiggle back and forth because who knows which players are not all lined up, but if we get them so they have the ability to move and get more matched up there. Okay. That's moving a little bit better. And you actually have some extension now. Okay, can you move it so that you have the extension? Oh my gosh. You get more of it than I do.
That's, wow, because usually I'm stuck about right there.
Yeah. Oh, and you can turn it now too.
Yeah, that's the thing. Before I just be like, just like that.
Okay, so tons more motion between the wrist, the forearm, the elbow, because all of the connections that he severed with the injury with the glass, the close encounter, everything healed, but it's just left like, okay, now what do I do? So we just matched up how different sides work together and support each other, and away you go. So you should actually get a little bit more out of that because it'll keep cascading some of the interconnections, and the circulation that changes will just allow your body to build on some more. So it's the difference between Legos and bodies. As the Legos keep going, or the body keeps going, Legos are where you end off. That's it. So it's really a super interesting example with all of the surgery that he's had to put this back together, and just to get him more ability to use his hand. And hopefully we can check back in a few months after you've had the other procedure and they've healed, and we can add fingers into the wrist and the elbow. So everybody, this is a really very specific but very cool example, and I'm happy to be able to help out. If you found this episode interesting and insightful, please give us a thumbs up, hit that subscribe button, and if you have some weird thing that's happened to you that you want to know if we can help put some more function together after it's all healed, we're in the northern suburbs of Chicago. Look us up online in the show notes, and you can make an appointment. If you're not camera shy, you can come in for a video session just like Steve did. And if you're a professional that you want to get these kind of results too, we do teach workshops. And you can find that information on our website, which is in the show notes. Thank you for watching, and thank you for coming in.
Thank you.